Welcome to Health, Hope, and Healing. I'm Jamie Lee, your host. Our show today is on the medical aspects of hypnosis, and my very special guest today is Mr. Jerry Kine. Jerry is the director of Omni Hypnosis Training Institute in Fort Lauderdale, Florida, and executive director of the National Board of Hypnosis Education and Certification. He's the director of the Florida Society of Professional Hypnotherapists and the vice president of the Massachusetts Institute of Hypnodontics. He serves on the board of advisors with the American Council of Hypnotist Examiners and the American Nurse Hypnotherapy Association. Welcome, Jerry.
Thank you for inviting me. This is going to be exciting, I think.
Yeah, it's wonderful to have you here. You've done so much and you know so much. And
it's called a lot of water under the bridge. See, I notice the wrinkles when I'm looking at myself on the screen, so.
And also for our viewers who don't know Jerry, lectures nationally and teaches some wonderful courses with doctors and nurses in the medical aspects, as well as treating patients that have various different ailments and illnesses, whether it's psychosomatic or cancer or pain, such as we had mentioned the hypnodontics. What is that?
Well, I think it's important we first get back to what hypnosis is before we can even start with hypnodontics or anything else.
Okay.
What is hypnosis? I think the question probably is what we're going to start with. And what it is, it's a method of accessing a deeper part of us. We're aware, all of us, that we have our conscious minds. That's the part of us that we're using all the time. It's the part of us that gives us reasons why we do the things we do. It's our intelligence. It's our rational, analytical mind. Below that level, we have this powerful organic computer called the subconscious mind. This is who we are. This is how we respond to things. This is where our belief systems is. And this is where hypnosis works. Hypnosis does not work with the conscious awareness. If problems of human behavior were solvable by the intellect, why, of course, every mental health practitioner in the world would be out of business. So the hypnotherapist goes into that organic computer, and that's where we work. So hypnosis is simply a method of accessing that computer, and we're more computer reprogrammers than we can help people through that process. So when we talk about hypnosis in any medical aspect, whether it's with dentistry or surgery or some of the neuroses and psychoses, that's where we have to go into. The most important thing we have to understand is when we're dealing with the person's mind is what we believe is going to happen is going to happen. Like we teach the students, what the mind expects to happen has a tendency to be realized. In dental hypnosis, we're not brought up with the belief system that we're going into the dentist's office and we're going to be relaxed and we're just going to enjoy every minute of this as they extract the tooth. We're not brought into the dental office with the concept that it's going to be comfortable and pain-free. We're told exactly the opposite. And that bypasses what we call the critical factor of our conscious mind. That analytical part of us goes into the subconscious mind and we have an anticipation of terror and pain, and that's what we have.
So someone can go to the dentist and not even get the numbing gel or needles and undergo hypnosis and be relaxed? Or do they still need that?
No, dental anesthesia is a chemical that dentists use to anesthetize or make numb a particular part of the body, namely the jaw. Mental anesthesia is much deeper than chemical anesthesia, and of course much safer. When a person is mentally anesthetized, the beauty is they can chew and whistle and take a drink of water without it falling all over their shirt. The only thing is they can't feel any discomfort.
Well, the mind will cause chemical responses in the body naturally.
Yes, of course it does.
Work on a deep level?
We don't really work from that aspect with hypnosis. Yes, the mind will release endorphins and natural types of other chemicals, but that's not a process of hypnosis. That may be a process of something else, but we don't rely on that. We can create anesthesia with an individual in just a matter of seconds with hypnosis and teach them how to do it in a matter of minutes. So this is some of the exciting aspects of how it works.
And since we're on the terminology of talking about medicine and how this is working. Is there a big difference between, let's say, medicine today and psychotherapy and hypnotherapy?
Yeah, you're talking the triangle is what you're saying. A lot of people think that hypnosis is a part of the psychological, psychoanalytical profession or the medical profession, and that's not true. Hypnosis is its own separate, distinct art, science, and modality of therapy. Now, yes, it can be incorporated in the area of psychology. It can be incorporated in medicine with great results, but it is its own profession, and it's being recognized as its own profession. I think one of the main differences, medicine and psychology basically deal with symptoms. When you don't go to the doctor's office unless you have a problem, you see.
A real big problem.
Yeah, and he's dealing with that symptom of something. The psychologist or the psychiatrist will go in and they must first create a label of a problem. They'll call you depressed or a phobic or something on this order. And then there's a modality of therapy once you're labeled with a particular problem. They deal with the conscious mind, you see. Again, we don't work with the conscious mind. We don't label people with problems. For example, if somebody comes to us for a problem of depression, we don't say, you have depression as your problem, but depression is the symptom of another problem. What causes the depression? And through different types of regression and abreaction work, we can go back and find the cause of the depression. Or, for example, a phobia. It's kind of interesting. Hypnotherapists have a totally different definition of phobia than the psychological profession does. For example, the psychological profession will say you're an agoraphobic, which is a fear of being outside in crowds. Or you have a phobia about flying. It's a fear of being in airplanes or a fear of water. The hypnotherapist says this is not what our belief system is. There's always new phobias coming up every year, you know. The reality of it is
phobia.
Yeah, a fear of the Johnny Carson show, I heard the latest one is, you see. But in any event, what we have decided a phobia is, and what we call it, is simply a fear of a fear. A person is not afraid of going outside. They're afraid of the terrible, debilitating fear that they feel when they're there. They're not afraid of being in an airplane. They're afraid of the terrible fear, the heart palpitations, the sweating, the passing out. And normally, for example, the psychological profession will use what they call a desensitization program, where they slowly acclimate people to going to a certain routine, whether it's going outside over months and years. Where a qualified hypnotherapist can usually eliminate a phobia completely within a person in 2 or 3 sessions by simply taking them back to the cause, using some of the different type of hypnoanalytic and hypnotherapeutical techniques that we have available to us that changes the person's perception of the event of what happened in the first place that causes phobia to rear its ugly head. And once we do that, well, we have a natural tendency to get better.
So is that like erase from their mind, or they just redo the scene?
No, they never erase. We can't erase anything. But the fear is neutralized. If you eliminate the cause of the problem, that terrible fear that happened to a person is one particular situation. If you change the perception of that, that's one way the phobia is removed. There are other ways, depending on what the cause was. But again, we don't label people with phobias. That's not our job. We're not psychologists. They come to us because they have a problem. We don't know what it is. We just say, go back as far as you need to go to the situation or event that caused this problem to rear its ugly head, and that's the perception that we work from.
And the results are usually quick.
Dramatically so.
I have a friend who was seeing a psychologist for years and years in group study for her fear of crowds. And a hypnotherapy session sounds like perhaps that's what's in order, something like that.
One of the other exciting areas we work in is in the area of speech, where we deal with stutterers. And in my classes, when we teach how to help a person with stuttering, I tell them that you don't go and teach a person to speak slowly. This is control, again. You're trying to control this problem with the conscious mind, and the conscious mind can't do this. What you have to do is understand that when a person stutters, almost always, 2 things come together at the same time in that person's past to cause a stutter. The first is, and it usually happens at a very, very young age, is that the child is made to talk, and he doesn't want to talk. He fouled up, and Daddy's yelling at the screen. He doesn't want to talk and explain what happened. So he starts crying, and the second thing that happens in conjunction with that is he's not allowed to cry. The father will say, if you don't stop crying, I'll beat you more.
It's like gasping for air.
Yeah, and we've found very simply that the stutter or the stammer is simply that cry below the level of conscious awareness. And in and they may have cried many times afterwards, but if we can take the people back and have them cry and vent that one cry, whether it was at 2 years old or whatever, the stutter just doesn't exist anymore.
That's wondering. So
yes, it is. And like I say, we can't compare this type of work with any other profession. We're not them and they're not us. This is just what we do, you see.
Sounds very effective. How young, what's the youngest you can hypnotize someone?
People, the youngest that are children can be generally, if you had to say an average, I'd say somewhere in the neighborhood of about 5 to 7. Mainly because they'll get the giggles and they're kind of comical and they can't concentrate very well. And there are other people who do nothing but working with children. They get along with children a lot better than some people do. But children are probably among the easiest to hypnotize. They don't have the hang-ups that the older folks.
And they probably love a guided imagery or something for positive thinking and health and feeling well about themselves.
Well, they do that with game playing, you know, let's pretend kind of stuff, and they have a wonderful time, and they're very, very responsive. There really is no such thing as a bad hypnosis subject. Not at all. A lot of schools over the years have taught that there's good subjects and bad subjects, and that's out of an ignorance of training or lack of training in that knowledge. Every human being accepts hypnosis. It's a natural thing. We're going in and out of hypnosis all day long. If a commercial hypnotizes us, we buy the product, you see. Two people in love are hypnotizing each other all the time.
So how do we hypnotize ourselves into health, good health, or becoming healthier after we're diagnosed with an illness?
Yeah, that's an important aspect. A person should learn you know, this is kind of interesting because self-hypnosis is sweeping the nation. It's going to be the biggest thing in the near future because the techniques of self-hypnosis have changed from hit and miss techniques written by people who really didn't know what they were talking about into now there's some powerfully, easily learned, solid techniques of self-hypnosis. That when people learn these techniques and learn how to program themselves, they basically can go ahead and fine-tune themselves for the rest of their life. When we made an application quite a number of years ago to teach children in 5th grade self-hypnosis, it was fascinating because of the ignorance of hypnosis by educated people, by college graduates, by doctors, lawyers, bankers. When we went and went out for permission to hypnotize the students, the parents came back with comments, well, nobody's going to control my child's mind, and hypnosis is voodoo, and these
like
are educated people.
Yeah.
And, of course, they're hypnotizing their children all day long. They don't know it. And if the kids could learn this in school, you would rapidly see the answer to drug and alcohol abuse and compulsive sexuality and all these other things.
So the younger child starts getting these positive thoughts where not only can they become better in school, better students, better grades, but health-wise they could start attuning their body and their immune system to make it stronger.
There is no question about that. We know that the more a person is run down mentally, the more they're open to illness and disease of both the mental and the physical nature. And we know that self-hypnosis can buoy and make much stronger our mental feelings about ourselves, our self-esteem, our self-worth, and also strengthen very powerfully our ability of our immune system to ward off those terrible illnesses that are floating around out there. Oh yeah, there's just such a tremendous advantage to any human being learning self-hypnosis. It's beyond my comprehension why it isn't mandatory in the school systems.
Yeah, there seems to be a large trend of nurses and therapists and doctors wanting to learn hypnosis to work with their patients when the drugs fail or they feel they don't want to keep them on too much medication as alternate therapies.
It seems nurses are probably among the most enlightened group of people out there. I've trained hundreds of nurses over the years. I've probably trained over 25,000 people in hypnosis. I probably have over 20,000 hours of sitting in a therapy chair working with individual people. And I can see the change happening out there. Nurses are getting on board, although they're not allowed to use hypnosis in the hospitals because of many reasons. I have been told, and I don't want to be quoted on this, that some people have used hypnosis with certain situations and just said that they're going to teach people to relax.
Like in between, like if someone's in pain and they can't bring them his Demerol for 4 hours, then there should be allowed to teach that person how to relax.
They should be, but they're not. They're not allowed to do it. And that's kind of sad in a way, but it's also understandable in another way because of the ignorance of doctors about hypnosis generally, and it's not their fault. It comes from a bias of training. If you haven't studied hypnosis, you don't know what it is, so you're caught up either by your own beliefs based on what you've seen in movies or television, or by what people who are inherently ignorant about hypnosis but say they're an authority on it have told you. And unfortunately, there's a lot of that going on.
So we're being more and more educated, not only by the people in the healthcare field, but people like myself and other people who have diagnoses of illness.
We see a lot of the younger physicians getting involved with taking good hypnosis courses. One of my early hypnosis instructors, may he rest in peace, his name was Vic Carnella. Vic told me something I never forgot. He said, progress does not move forward by knowledge and experience and testing, but it really moves forward from funeral to funeral. And as the younger people are allowed to come up with the new ideas and concepts and incorporate them, that's when we see the progress. Sometimes we wish it would move a little faster.
Yeah, so we're stuck in old doctrines and laws and regulations.
We are, and it's because of an ignorance of hypnotism. Hypnotism in the medical world, and that's what this show is about, can bring unbelievable relief to people. A qualified hypnotherapist can go into a hospice, for example, with people with terrible and terminal cancer, and in a matter of a half an hour, 40 minutes, can have that person, providing everything else is working, up and walking around pain-free without any aspirin, where they may have reached the limit of the drug capability. For example, another thing that a lot of problems we have as hypnotists are documentation of our work. Some people say, well, it works for a while, but then it fades. Now, what I've done and a lot of other hypnotists are doing now is documenting our work through videotaping of the clients and the work that we do. And I think one of the real fields of medical hypnosis that's been left unsaid but is tremendous is in the area of painless childbirth. There is absolutely, providing the birth is normal, there's nothing going wrong, there is absolutely no reason on the face of the earth for any woman to have to feel the terrible pain that they feel.
No epidurals, no.
No, we just finished with a woman that we videotaped her 4 sessions of hypnosis. We videotaped the birth, where she's laughing and giggling and having a wonderful time, and then a post-birth interview where she has her baby with her and explaining the difference between her hypnosis childbirth, which was marvelous, and her first birth, where she was in horrendous, powerful labor for over 8 hours. And they had to do quite a bit, had to do the episiotomy. Well, with hypnotic childbirth, a woman just dilates perfectly, beautifully, naturally. The baby comes out of there like it's shot out of a cannon, and they laugh and they giggle, and we program that there's no such thing as labor pains, but these are just natural, wonderful, warm, loving contractions. There's a lot of deprogramming we have to do to program in the truth, you see.
This all sounds so wonderful and so easy. Is it easy for each person to be hypnotized? Does it take a long time for them to learn these techniques?
Is it easy to be hypnotized? Here's the rule, and this is an unyielding rule. Okay. A person will accept the state of hypnotism in direct relationship to the fear they have of that state, period. There is no such thing as a good subject or a bad subject. If a person doesn't enter hypnosis, it's because they're frightened of it or they have a misconception about it that stops the process. If a person wants to do hypnosis, if a person has no fears or misconceptions of it, then hypnosis, deep hypnosis, can be instigated in a matter of seconds. Not minutes or hours, but literally you can take a person from the normal conscious awareness into a beautiful deep state of somnambulistic hypnosis, that's the deep working state of it, in a matter of 3 to 5 seconds. We usually don't do that with clients because their mental expectation is one of long-term relaxation, so generally we have to build a little of that in so it meets their expectations of it, you see.
I had a patient I was working with who was very ill, and he said he wanted to get better, but he kept getting worse. Is this because he didn't really want to get better? And that
you're asking me to make a diagnosis, and the beautiful thing about a hypnotist, we don't diagnose. But if that's the problem with a person, we would get him into trance, and we just simply say, now I want you to go back as far as you have to go to in your past life.
But if his mind is stubborn, it would
well, that's his conscious mind. You're talking about the conscious. The subconscious mind will work. That's the computer. Go back as far as you need to go, the situation or event that first caused this illness to come in and requires it to be there and then to continue with it.
Oh, so it's like...
Boom! You go right back to it.
So it's like there's a door between the conscious and subconscious that opens
up. Yeah, we call that the critical factor of the conscious mind. In hypnosis, we set aside the critical factor and gives us an access to that computer. And we're the only profession in the world that can do this. There is no other one.
Okay, now how would you deal with someone who is diagnosed with cancer? Is there a way, like I've been reading in books and everything, well, I'm blasting my cancer cells away, I'm doing this meditation. Does that work? Or does that just make them feel better? Is there,
it depends.
Has there been medical changes documented through hypnosis?
We've done quite a bit of work with cancer and more recently with AIDS patients. A lot of this is, there is no simplistic answer. But in general, you would have to say, when did you get to see the patient? Is this patient near death? If the person is near death, from my experience, getting that person into a remission situation and eliminate the cancer is just dreaming. At that point, your job as a hypnotherapist is to remove the discomfort they're feeling. Now, if you can get cancer in the early stages, then through visualization techniques, creating feelings within the person. You see, anybody with cancer, if you're in my profession long enough, you're going to realize has a tremendous amount of anger, hate, and resentment against somebody or a group of people. And the only way they're going to begin the cure, first of all, is by wiping that slate clean and getting rid of that anger, that hate that causes to eat away at the mind and eventually starts eating away at the body. So that's what you first have to clean up before you can get into some type of visualization technique that, yes, can and has done many times what the medical world says causes a remission. And fine, I'll settle for that, you see.
That's
no question about it.
So when these cancer patients, so to speak, like I had mentioned, I read, they're blasting away their cancer cells. I thought that was sort of violent or angry, and if someone is already angry, does that, how that you get rid of anger with anger?
I guess it depends on the individual. One of the techniques we use is we have the people imagine the cancer is a round red ball of cells, and it's attacked and being chewed up by a pack of voracious sharks, you see. And they kind of get a kick out of that one. The interesting thing is what you can accomplish through suggestion. One of my students told a person once that they would notice a red tint in their urine over the next couple of days as this tumor was being expelled from the sharks chewing it up and spitting it out. And he asked me what I thought about that, and I said, well, I have no idea, but he reported back that the client did have a red tint to the urine, and the tumor itself was just being eliminated.
So physical manifestations happen through hypnosis, like a kidney stone?
Physical manifestations, there is a growing tendency by physicians in the mind-body connection to understand the mind-body connection. What we're talking about is psychosomatic illnesses. Psycho meaning the mind, soma, the body, the mind causes the illness. For example, we know again in hypnotherapy, and I hate to put this in, and to make this sound simplistic, but we do work under the KISS theory with hypnosis. We don't profess to have all the knowledge of psychologists or psychiatrists. We don't do their work. We just go in and fix the problem. You see, we don't worry too much about all this other thing. But we also notice, for example, in the area of allergies, it's rarely I haven't found the cause of an allergy and been able to eliminate it. It's, if you got time for about a 30-second case history, a man comes to me with a terrible allergy to hay fever, pollen weed, and things on this order, and we took him back to the situation or event that caused the allergy. And he was in a terrible automobile accident. A truck drove him off the road. His car rolled over. In the heat of the summer on a Georgia side road, and he couldn't move his body. His face was pushed down into this ragweed and grass, and every breath he was just inhaling this, and the fear that was associated with this terrible experience anchored him, locked him in there, you see. And then some boys came who were coming back from a beer party. Thank God there was a bunch of these burly guys, and they actually lifted the car off of him. And to make a long story short, we discovered every time his allergy came on during a period of stress and fear. And it was anchored back. When I feel fear, I smell this grass coming up. And of course, through some very simple techniques, we're able to eliminate that also. Sometimes people feel ugly on the inside, and they have a need to reflect that ugliness in eczema, edema, other type of skin ailments and diseases also, you see.
This is just so totally fascinating. So no matter what the illness is, whether it's developed or whether it's past partum and has been there a long time, or if someone has kidney stones or trying to pass it, the pain can be relieved with hypnosis. Possibly even the kidney stone could be passed. It just is working real well with the medical profession. So to summarize this, Jerry, because we're running out of time, how do you see the future coming with hypnosis in the medical profession?
I wish I could be excited about it.
10 words or less.
It's going to be slow coming. Unfortunately, it's going to be slow coming. It should be fast. It could dramatically help the physician in his work. It could dramatically help the psychologist rapidly create change. But I just don't see it being coming in with the speed and facility that we'd like to have it come in.
So perhaps their fear can be alleviated through hypnosis.
The fear of the doctors?
The fear of the hypnotherapist.
It could.
Okay.
Whether it will or not, I don't know.
Okay, thank you for joining us.
It's been great.
Thank you for joining us today on Health, Hope, and Healing.